we are going to look at very important high-yield clinical questions that are often repeated in multiple exams. So, the first one is common movement disorder. In Parkinson disease, there is pill roll tremor, rigidity, cogwheel rigidity, and bradykinesia will be there. Postural inability and gait problem, shuffling gait will be there in Parkinson disease. Another one is essential tremor. Now these are the type of tremors that are worsen with movement. These tremors worsen with movement, and in this type of tremors there will be it improves with it improves with rest and worsen with movement. Next one is Huntington disease. Huntington disease, there will be chorea, jerky movement, and psychiatric symptoms with dementia and dystonia. In dystonia, what happens? There is a sustained involuntary movement. Is the word dystonia means involuntary movement will be there. Twisting, repeated movement with cervical dystonia is also present. That is called as torticollis. Next one is myoclonus. It is sudden, brief, shock-like jerks and seen in epilepsy, metabolic disturbance, and anoxic brain injury. Now, next one is tics. Tics is repetitive, brief, purposeless motion, movement, which is seen in Tourette syndrome, and it can be suppressed temporarily. Now, next important point is Kwashiorkor disease. It is malnutrition in newborn babies or in infants. There will be severe protein malnutrition in Kwashiorkor disease. It usually occurs in the children of age in the 6 month, after 3 years, and after weaning and breastfeeding milk, uh, breast milk, and babies having deficiency of carbohydrate protein rich diet and breastfeeding deficiency can also lead to the Kwashiorkor disease. In Kwashiorkor disease, there will be edema on the foot. Pedal edema will be there starting on the leg, then generalizes irritability. Baby can develop hypoglycemia, hypothermia, and ionic balance will be improper, and enlarged fatty liver will be there, hepatomegaly, and muscle wasting marked by edema will be there. Hyperpigmentation, peeling of skin, dermatosis will be present in this condition, and hair changes, brittle hair will be there, weakness will be there in the babies, and then discoloration will be there. These baby have diarrhea and growth retardation with apathy, lethargy, and dietary protein deficiency will be there in the babies. Now, poverty is also contributing factor in Kwashiorkor disease. Are those people who are living in slums, and babies are often prone to develop Kwashiorkor disease. Infections, poor maternal education, are giving avoiding of breastfeeding to the babies. Natural disasters or famine condition can contribute to this condition. Now, when we take the history from mother or the parents of the baby, we will get child weaning of breast milk early, mother avoidance of breastfeeding to the baby, any famine condition or any recurrent infection, chest infection or diarrhea in the babies. Socioeconomic background is low income, have more common occurrence of Kwashiorkor disease. Those people who cannot afford proper diet of the baby. Family history may show poor nutrition in siblings can also contribute to this condition. And then when we perform laboratory investigations, we will find hypoalbuminemia in the babies and low protein with low with anemic condition and also anemia, electrolyte imbalance, hypokalemia, hyponatremia, sugar, maybe also low hypoglycemia, and the babies can occur with hypothermia. LFTs will be deranged, elevated transamin levels, and hypoglycemic condition will be there in the babies. Treatment is stabilization phase from 1 to 7 days. Treatment is also to prevent hypoglycemia and hypothermia. Keep child warm, give sips of ORS, and treat the infection if any present. Also, we have to prescribe multivitamins like vitamin A to the babies in order to prevent corneal sclerosis. Now, next one is neuropathic ulcer. In neuropathic ulcer, it occurs because of long-standing diabetes mellitus patient. When there is pin punch out ulcer, there will be pain, and pressure area ulcer are more common in, especially in plantar of the foot, and it is surrounded with the callus, and also there is absence of sensation. So these ulcers are developed. In that condition, we call it neuropathic ulcer.